So in this video, we will be discussing the brachial plexus. So the brachial plexus is a series of nerves that supply electrical impulses and innervation to the upper limb. We will explain what brachial plexus means, the roots that makes up the brachial plexus, then how the roots forms trunks, how the roots from C5 to T1 forms the upper, middle, and lower trunk. Then how the trunk forms the division, which is anterior, all anterior division and all the posterior divisions. Then how division forms the cord, and then how the cord ends in terminal branches with the clinical correlation. All right, so for the brachial plexus, there are a series of spinal nerve that arises from the fifth cervical vertebrae to the first thoracic vertebrae. And these are spinal nerves that arise from the backbone, and they are the anterior rami of the spinal nerve. So C5, C6, C7, C8, and T1. And these are nerves that originate from the spinal cord to other parts of the body. And then I made mention of anterior rami. Okay, so here is the spinal cord. So this is the anterior nerve root. That is the nerve carrying impulses out of the spinal cord, and posterior nerve roots carrying impulses into the spinal cord. Okay, so the anterior and posterior nerve roots are mixed at this point and form a spinal ganglia. And then when we move forward from there, you will see that this mixture of posterior and anterior nerve roots splits into anterior ramus and posterior ramus. Ramus means branches, or anterior branch, posterior branch. Okay, so this posterior ramus travels backward to give innervation to all the muscles in the posterior part of the body, while the anterior ramus supplies the anterior part of the body. So this anterior ramus in the brachial plexus, which is the cervical and the first thoracic, supplies the upper limb or upper extremities. The next thing to consider is the nerve roots, and these are roots arising from C5, C6, C7, C8, T1. And there's little contribution from the fourth cervical vertebrae as well as the second thoracic vertebrae. Basically, the root of the brachial plexus is made of 5 nerves. Now, here is a little misconception and confusion that affects students. Now, the cervical bone are 7 in number, but the nerves that are arising from the cervical vertebrae are 8. So how is that possible? The reason why the body is able to have 8 cervical spinal nerve and 7 cervical vertebrae is because the first vertebrae arose from below the skull, okay, then the second will be between the first cervical bone and second bone. So the third spinal nerve will be between C2 and C3 bone. The fourth spinal nerve will be between C3 and C4 bone. So that continues in order to admit the 8 spinal nerve. So if we count the number of nerve, 1, 2, 3, 4, 5, 6, 7, 8. The 8 spinal nerve is between the 7th cervical and the first thoracic. And the first thoracic will now be below the first thoracic vertebrae. So we've established the fact that there are 5 nerve roots, which is C5 to T1, and with little contribution from C4 and T2. Now we'll look at the location of the nerve roots. Now for the location of the nerve roots are located between the anterior scalene muscle and the middle scalene muscle, located deeply within the neck, just lateral to the cervical vertebrae. Now this whole scalene muscle have anterior fiber, middle fiber, and posterior fiber. So the roots of the spinal nerve that are supplying the brachial, or that are forming brachial plexus, are found in between the anterior and the middle scalene muscle, just the moment it exits the cervical bone. All right, so we talk about branches that arises directly from the roots, because there are some other branches that arise. The first is dorsal-scapular nerve. The next is long thoracic nerve. You can see dorsal-scapular nerve is just a branch of C5, so it goes this way. And then the long thoracic nerve gets its branches from C5, another from C6, and another from C7. So it's long thoracic nerve. Okay, so the dorsal spinal nerve supplies the rhomboid major and minor muscle and the levator scapulae muscle, while the long thoracic nerve supplies the serratus anterior muscle. Dorsal spinal nerve supplies the levator scapulae muscle, rhomboid major muscle, and rhomboid minor muscle, while the long thoracic nerve supplies the serratus anterior muscle. So that's the major branch from the roots. Now, for the clinical correlates at this level can occur as a result of extensive widening of the angle between the neck and the shoulder. So if that is vigorously stretched, maybe for example when someone experiences a large traction on the neck, or when the person is falling head down and the point of impact is between the head and shoulder, and it can expand the angle between the neck and shoulder, thereby injuring the roots of the spinal cord. This can affect the first 2 nerve roots, which is C5 and C6. Then there is another issue that happens during childbearing when the completely developed fetus is about to be delivered and the medical practitioners are finding it difficult to deliver the baby. through the vaginal canal, maybe as a result of the size of the shoulder or the size of the head. When the head is removed from within the vaginal canal, the person delivering the baby can find a way to manipulate the head in order for the shoulder to exit the vaginal canal. But care must be taken because there are certain children where the head and the shoulder are vigorously pulled. Through this action, the nerve roots gets injured right here. And also, if the first exit of the fetus is through its arm, and then the person delivering the child pulls the arm just to allow for the other part of the body of the fetus to exit the vaginal canal, then there will be extensive stretch on the arm of the baby that's to be delivered, and that can affect the roots of the brachial plexus generally. And if the issue is with the upper roots, that is C5 and C6, then the baby is going to develop a waiter's tip, just like this. So you see an individual whose hand stays this way. It must have been as a result of injury to the upper roots. And this kind of paralysis is called Erb's palsy. While if it's on the lower root, then the hand stays this way. So if there's an injury to the lower root, so it stays this way. But if there's an injury to the upper, it stays this way. So we'll move to the next section, which is the trunk of the brachial plexus. And the trunk is the next part of the brachial plexus after the roots. So we are going to talk about the formation of the trunk. Now the trunk is formed by the union of the upper two roots, C5 and C6, the middle root, and the union of the lower two roots, C8 and T1. So you have the upper trunk, the middle trunk, and the lower trunk. Okay, now where is the location of the trunk? The trunk is located in the posterior triangle of the neck, right here, lateral to the scaly muscles. So these are the scaly muscles. The trunk is located lateral to it in the posterior triangle. So it passes over the first rib and below the clavicle before becoming the next part of the brachial plexus. Now there are some branches that arise. Now for the upper trunk, there are two branches that arise from it. So the first branch is the suprascapular nerve, suprascapular nerve. And then the next branch is the subclavius nerve, subclavius nerve. So the suprascapular nerve supplies the supraspinatus muscle and the infraspinatus muscle. Why? The subclavius nerve supplies the subclavius muscle, and the subclavius muscle lies below the clavicle. All right, so that's the only branch. So we'll move to the next part, which is the division. So we are done with the roots, trunks, then we get to the division. Root is located between the anterior and middle scaly muscle. Trunk is located in the posterior triangle of the neck and lateral to the scaly muscle. Then we move to the divisions. Now, the division is located behind the clavicle and anterior to the posterior. Now, let's talk about the formation. So the divisions are 6 in number, and they are formed as a result of the division of the trunk. So the superior trunk or upper trunk divides into anterior and posterior division. The middle trunk divides into anterior and posterior division. And the lower trunk or inferior trunk divides into anterior and posterior division. So that makes it 6 divisions. Now, here's one thing you should note. All anterior division works together in supplying the muscles that flex the upper limb. For example, this muscle here flexes the upper limb. So it's from the anterior division. This muscle in the forearm flex the wrist. This muscle here flex the fingers. All these muscles in the anterior division flex the upper limb, while the muscles in the posterior division extend the upper limb. So the posterior division, the nerve that forms the posterior division, helps to extend the upper limb. Now for the clinical correlates, injury can affect the divisions. For example, if there is a fracture to the clavicle, that can injure one of the nerves within the division of the brachial plexus. And if the posterior divisions are affected, then the muscles in the posterior side of the upper limb will be paralyzed, and that will lead to wrist drop. So you won't be able to extend your wrist. So move to the cord. So we are through with the root, trunk, division, cord. There are 3 types of cord: the lateral cord, posterior cord, and the medial cord. So how is the lateral cord formed from the division? Now, the first anterior division, okay, the anterior division of the upper trunk and the anterior division of the middle trunk join together to form the lateral cord as lateral side. Then all the 3 posterior divisions forms the posterior cord. Okay, posterior division of superior trunk, posterior division of middle trunk, posterior division of inferior trunk, all join together to form posterior cord. All right, for the medial cord is a continuation of the anterior division of the inferior trunk. Now, let's talk about the location of the cord. The cord of the spinal cord is located in the axilla or armpit, and there are branches of nerve that arises from the cord. The first branch is the lateral pectoral nerve, right here. So the lateral pectoral nerve is a branch from the lateral cord. Now, this lateral pectoral nerve supplies the pectoralis major and minor. Okay? So the branch is lateral pectoral nerve. Now, the posterior cord gives 3 branches. Okay, upper subscapular nerve, lower subscapular nerve, and the middle one, thoracodorsal nerve. Now, when we move to the medial cord, the nerve branches that arises from it is the medial pectoral nerve, medial cutaneous nerve of the arm, and medial cutaneous nerve of the forearm. So remember again, so these are the branches: lateral pectoral nerve, and the branches of the posterior division is upper scapular nerve, thoracodorsal nerve, and the subscapular nerve. So the upper subscapular nerve supplies the subscapularis muscle, the upper part. The lower subscapular nerve supplies the lower part of subscapularis and the teres major muscle. The thoracodorsal nerve supplies the latissimus dorsi muscle. Then we move to the next branch, which is the medial brachial cutaneous nerve. Brachial means arm. So in another textbook, you'll find it as medial cutaneous nerve of the arm. Then the next branch is medial antebrachial cutaneous nerve. So antebrachial is forearm. All right, so we are looking at the terminal branches of the brachial plexus. That is where all these nerve roots ends. Okay, there are 5 major terminal branches of the brachial plexus. So these are arrangements from the lateral to the medial: musculocutaneous nerve, the axillary nerve, the radial nerve, the medial nerve, and the ulnar nerve. So we start with the first terminal branch, which is musculocutaneous nerve. We start with the musculocutaneous nerve. So where does it come from? Look at this red dot. This is the musculocutaneous nerve. So this nerve originates from C5 to C7 root, and the musculocutaneous nerve is coming from the lateral cord. Lateral cord is formed by the union of the anterior division of the upper trunk and anterior division of the middle trunk. This nerve supplies the muscles in the anterior arm, that is BBC, okay, biceps brachii, brachialis muscle, and coracobrachialis. So those are the anterior part of the arm. The next branch we will look at is the axillary nerve. So the axillary nerve starts from the posterior cord. So as we move from the posterior cord splits into 2 terminal branches. One of it is axillary nerve, which we will be explaining, and the radial nerve, which we will explain very soon. The axillary nerve supplies the deltoid muscle and the teres minor muscle. Now the axillary nerve passes through the surgical neck. Look at it here. It passes lateral. When the surgical neck of the humerus is injured, then this injury can affect the axillary nerve, thereby leading to paralysis, because the deltoid muscle cannot abduct the arm anymore. We move to the next terminal branch, which is the radial nerve. The radial nerve is the largest nerve in the brachial plexus, okay? And it's also part of the branches of the posterior cord. Posterior cord splits into 2, axillary nerve and radial nerve. So it passes through the mid shaft of the humerus. Behind it, through the radial groove, there's a groove for the radial nerve, and if the humerus is fractured at the mid shaft, the radial nerve is going to be affected, and all the posterior muscles that are supplied by this radial nerve will be paralyzed, and that will lead to wrist stroke. So it passes over to the anatomical snuff box as well and supply all the extension muscles in the posterior arm as well as the posterior forearm. Now the clinical correlates affecting the radial nerve. Okay, so the first is when there's a mid shaft humeral fracture. If the fracture occurs in the mid shaft, it will lead to wrist drop. So here is an image showing the next clinical correlate to the radial nerve is Saturday night palsy. So if you find yourself in this position will lead to compression of the radial nerve, and that can lead to Saturday night palsy. The reason why they give it Saturday night palsy is because every Saturday people find a way to let loose and go to the club, and then on getting home from club, get wasted and make this kind of posture. So that's the reason why this condition is called Saturday night palsy. But Saturday night palsy is because of the compression of the radial nerve in the mid-humeral shaft, because at this point, this person is compressing the radial nerve. Also, in this wooden shade, if you sit this way and assume this position, you are going to compress the radial nerve, and you start feeling unusual sensation at the posterior side of your hand. Next is honeymoon palsy. Okay, so this is peculiar to individuals that are in relationship, and during cuddling, the lady would want to be the spoon and would love to rest her head on the guy's arm. Okay, so initially it's lovely and nice, but if she stays there, let's say all through the night and sleeps off, the guy might lose sensation of all the posterior muscles of the hand, and the guy may suffer some temporary paralysis of the hand as a result of the compression at the mid-humeral shaft. All right. So you notice that if you find yourself in this position while sleeping, you can compress the radial nerve at this part, and you start having needle-like sensation or paresthesis. Okay, so that's why it is not advisable to rest on your hand in this position, okay? Because this is the radial nerve. Look at the course. It goes radial groove through the lateral epicondyle. It crosses over to the radial bone, and then it moves into the anatomical snub box to supply these lateral three fingers. The medial nerve originates from the union of lateral and medial cord. Medial nerve receives a branch from the lateral cord right here, and another branch from the medial cord right here, which forms the medial nerve. Compression of the wrist at this region will cause carpal tunnel syndrome, and that carpal tunnel syndrome is as a result of injury to the medial nerve. So the medial nerve supplies all the flexors in the forearm on the radial side, and also the thinner muscles, and that will lead to the person's finger staying this way. And this is like a symbolic representation of when giving a benediction. Okay, so that's the reason why they call it hand of benediction. Then the supracondylar fracture can injure the medial nerve. But if it's a fracture at the medial epicondyle, ulnar nerve is going to be injured. Now we move to the last termination or last terminal branch of the brachial plexus, which is the ulnar nerve. Now the ulnar nerve is a continuation of the medial cord. And if we trace it back, the medial cord has its roots from the last two roots, C8 and C1. So the ulnar nerve is from medial cord. It passes posterior to the medial epicondyle, the humerus. So when you rest your elbow for a very long time, start feeling or losing sensation on these two fingers and on this anterior side of the palm. Then if you hit the medial epicondyle side of the elbow on a very hard surface, you will have this experience of a funny bone, just like an electrocution, all through your hand and forearm. The ulnar nerve supplies the forearm muscles, the muscles on the ulnar side, like the flexor carpi ulnaris, the ulnar side. Okay, the medial nerve supplies that in the radial side anteriorly. But if we move to the back, that is supplied by the radial nerve. All right, then for the hand, the ulnar nerve supplies the little finger and the ring finger, while the middle finger, the index, and the thumb are supplied by the medial nerve. Okay, now the clinical correlates affecting the ulnar nerve. Cubital tunnel syndrome, right at the elbow, and that is because of compression of the ulnar nerve behind the medial epicondyle. Next is Guyon's canal lesion. Okay, and the most people that are at risk are the cyclists. Because of the way their hand is positioned, it can compress the ulnar nerve at the medial side. Look at the cause of the ulnar nerve right here on the ulnar side, and then gives a branch to the palm and supply the medial two fingers, that's little finger and middle, and then half of the ring fingers.